I start almost every conversation with patients by saying the reason we treat cancer is so that you can do all of the things you wanted to do before you were diagnosed. And specifically with germ cell tumor patients, testicular cancer patients, these are often young men, either who've just started a family or thinking about starting a family. And so we want to take into account all of those things that they wanted to do before they were diagnosed with cancer. Do you want to start a family? What are your career aspirations? Do you want to travel and see the world? And this can be applicable to older patients too with other forms of cancer. We can account for their golf game, their relationship with their wives. They want to spend time with their grandkids. All of those things factor into how we treat and move their cancer management forward. My name is Phillip Pierorazio, and I am the chief of the Section of Urology at Penn Presbyterian Medical Center. I'm a urologic oncologist, so I take care of patients with cancers of the urinary tract. Most common ones we see are prostate cancer, bladder cancer, kidney tumors. My specific expertise is in kidney cancer or renal cell carcinoma, prostate cancer, testicular cancer, otherwise known as germ cell tumors, as well as a really rare form of bladder cancer that forms in the kidneys or ureters, and that's called upper tract urothelial cancer. Kidney cancers are fairly common, 60 to 80,000 people per year diagnosed with kidney tumors, but we don't have a blood or urine test to figure out what's going on with people's kidneys before we find these tumors on a CT scan or an MRI. So working with collaborators here to find a biomarker is one of my real big interests. But one of the other ones is influencing the way we manage patients with kidney cancer, kind of leveling the playing field to make sure that we're delivering excellent care, not just at Penn, but around the country. I really think that surgery is our last line for a lot of patients with cancer. And if we have minimally invasive options or ways to keep people out of the operating room, that's always the first thing I think about. The second thing is I really try and make sure patients understand their disease. It makes it much easier for them to understand their pathway and their journey when they understand what's happening to them, why we're making certain recommendations, and that way we can proceed through the steps of cancer treatment together. One of the greatest joys I get from treating patients, both surgically and for cancer, is the long-term relationship you build with them. I think that's why they come to Penn. That's why they come to see us. Not only do they want to know the options, but they want to know what we would choose if they were a member of our family.